Hello everyone, how's it going? You've probably heard of someone having a TIA, but that's when someone experiences symptoms similar to what people experience when they're having a stroke, but the symptoms last for only a short time. Well, is having a TIA a medical emergency? What did a new study show about having a TIA and cognitive decline? And can a TIA be a warning? Well, if that sounds interesting to you, then keep watching. So what is a TIA? It is a transient ischemic attack, and it's caused by a brief blockage of blood flow to the brain. It usually only lasts a few minutes, but it can last up to 24 hours, but that's pretty rare. Now, the difference between a stroke and a TIA is that a TIA stops on its own. A stroke actually requires treatment, and it leaves evidence behind on an MRI scan. So is a TIA a medical emergency? Yes, it should be treated as an emergency because you don't know how long it will last. According to the American Stroke Association, 2 in 5 people who were given an appropriate scan found out that they had actually had a stroke, not a TIA. Now, when someone experiences a TIA, the symptoms are very similar to that of a stroke. Well, what are the symptoms? Well, according to the Mayo Clinic, a person may suddenly experience weakness, numbness, or paralysis in the face, arm, or leg, and it's typically on one side of the body. They may experience slurred speech or trouble understanding others, blindness in one or both eyes or double vision, dizziness or loss of balance or coordination. So you would always want to call 911 right away. A neurologist at Mount Sinai Hospital in New York City, she said, "We know time is brain. That means that the longer the brain isn't getting enough blood flow, the more likely there's going to be permanent injury." So what if you just had a TIA? What did a recent study show about whether or not having a TIA was a risk factor for cognitive decline? Is having a TIA a warning? What can we do to reduce our risk of having a future stroke? We're going to discuss that shortly, but first I'd like to remind you to please like and subscribe, and make sure you choose the option to be notified every time a new video comes out if you want to make sure you don't miss any. Another reminder is to check out the description box below. You can see the links that'll be there that'll show you where I gathered the information for the video. And if you have something you'd like to share on this topic, feel free to leave a comment below. A recent study showed that having a TIA was a risk factor for cognitive decline, with an estimated annual decline similar to that of a single ischemic stroke. So even though TIAs are usually associated with no long-term or permanent damage, this study showed that a TIA can have sufficient impact, and so they can be associated with long-term decline. I did read, though, it's more likely to affect the memory than verbal skills. Now, are TIAs a warning? Definitely. Nearly 1 in 5 have a stroke within 90 days. So you definitely want to get medical attention right away. Healthcare professionals can actually look to see if there are any treatable conditions, and making sure you get the right treatment can really reduce your risk of having a future stroke. It's really quite amazing, the medications and the procedures that are available now to keep someone from having to experience a stroke. So what are some risk factors we can't control? Well, obviously our family history, our age. Stroke rates actually double every 10 years after age 55. As we age, blood vessels become less flexible. But there are some risk factors that we can control, some lifestyle choices. One thing is we can choose not to smoke. Smoking increases chances of blood clots. We can limit our alcohol intake and avoid recreational drugs. Now, since a buildup of cholesterol containing fatty deposits called plaques could cause a blockage in an artery, that could lead to a stroke, we could take a look at our diet and do our best to limit cholesterol and fat, try to make sure we're eating enough fruits and vegetables, and try to limit our sodium. Now, something that can be helpful as well is to exercise regularly. It's recommended to try to get in 30 minutes a day, most days, or whatever your doctor says is safe for you. And in recent years, we've learned that it is beneficial even to break those 30 minutes up in 10 or 15-minute increments throughout the day. It's also important to try to maintain a healthy weight. If you have diabetes, you want to make sure that's under control. Definitely want to make sure your blood pressure is under control. We want to make sure we keep up with all of our medical appointments, especially if you have any heart disease. atrial fibrillation or heart rhythm irregularities. Now, having a TIA is not a harmless event. Definitely would want to call 911 right away. Now, you want to keep in mind the acronym FAST, F for face, A for arm, S for speech, and T for time. So if you have face drooping, arm weakness, speech difficulties, that means it's time to call 911. None of us wants to experience a stroke that could limit our quality of life. So we definitely don't want to take chances, but we want to seek medical assistance right away. That can help us to avoid some serious damage in the present as well as in the future. Well, I hope you've enjoyed the information in today's video, and I hope to see you in the next video where we'll discuss another way we can improve our health.